Well, good afternoon. A little over a week ago, we launched an emergency recruitment drive to encourage recently retired nurses and doctors to come back to the NHS to help our country to deal with coronavirus. We focused on staff who have left within the last 3 years. We're also asking social care staff to come back to help our workforce, to help our country. This is an extraordinary time with extraordinary demands being placed upon our health and social care services. So I'm really pleased that here in Wales, more than 1,300 health and social care professionals have already answered the call in the first week of the recruitment drive and said that they are willing to return to work. That includes 670 doctors and 416 nurses and midwives, plus 194 allied healthcare professionals. We know that there are many more people who want to come back to work in NHS Wales, in addition to the doctors and the nurses and the midwives who have re-registered with the General Medical Council and the Nursing and Midwifery Council respectively. 348 pharmacists and pharmacy technicians have also been automatically registered with the General Pharmaceutical Council, and 935 allied healthcare professionals have automatically been registered with the Health and Care Professions Council. There are a further 3,760 medical, nursing, midwifery, paramedic and health professional students who could also be available to work within our NHS. Social Care Wales has sent out 850 letters to people who are previously registered, asking them if they will come back to work. It is really heartening to see people returning to work in the NHS at this time. A fantastic show of the resilience and the dedication by so many in such unprecedented times. And I want to thank every person who made the decision to come out of retirement to rejoin their colleagues on the front line to help our NHS. We know that our NHS will need to treat and care for a large number of people over the coming weeks and months. I want to thank everyone right across health and social care services for the fantastic work, even in these times, extraordinary commitment that they provide for services and communities in Wales day in and day out. We really do appreciate everything that you are continuing to do for us. I also want to say a few words about the incredible response we've had from people throughout Wales who offered to volunteer to support people who are isolating or vulnerable and to support our NHS. In normal times, we regularly say that Wales is a nation of volunteers, with more than 900,000 people volunteering. Because of that, we have good national structures in place to enable people to volunteer through the Volunteer Wales website. Over the past month, we've seen an incredible response in people registering to volunteer. Last week alone, more than 1,000 people a day have been signing up via the website. We now have nearly 22,000 people in Wales who have registered to volunteer to support their community. Every one of those volunteers will play an important role in keeping people safe at home, helping to protect our NHS, and of course, helping to save lives. I have to take questions in the room that I understand we have some to deal with remotely as well. So I'll go around with Felicity and then around the room. Felicity from BBC.
Thank you very much indeed. Can I ask you about the testing contract that collapsed? Can you confirm Roche is the company in question? And could you give us more detail on the nature of the agreement as the Welsh Government understood it, and also more detail on what has replaced it in terms of the collective sourcing that's been referred to?
Well, this is the question about the testing deal that we confirmed wasn't going ahead. And I don't have much further to add, so I'll restate the position. We're absolutely not going to name the company that we're due to provide 5,000 tests for Wales. We've been really clear about that. Our objective is to get more testing available, focus on delivering that. We had a written undertaking, an agreement between us, and we had a clear agreement for that company team to come into Wales to set up the infrastructure required to provide those additional tests. But what I have been able to confirm over the weekend, both in our actual testing plan, but in interviews with TV and Channel 4, about our ability to nevertheless scale up our testing capacity within 2 to 3 weeks to be at about 5,000 tests a day. And we also expect that by the end of May we'll have a further 4,000 tests because of the UK-wide arrangement we signed up to together with colleagues in Scotland, Northern Ireland and England. And we also, of course, expect within a matter of weeks to have the new antibody tests available as well.
Thank you. And a second question. Figures on how many NHS staff are currently off work, either sick or self-isolating at the moment, and how many have been tested and able to return to work, percentages of the workforce would you have?
Okay, so the question is about how many NHS staff are off the workplace and where we are with testing our frontline workers. On some of the detail of the numbers of NHS staff, we'll have a briefing on Thursday with the Chief Exec of NHS Wales to provide some of the more operational detail and so that level of detail you're asking for. So questions in advance, but the sort of detail you're looking for would be really helpful to make provided on Thursday when the Chief Exec of NHS Wales is here before you. But on the numbers of frontline tasks that have been, staff that have been tested, over the weekend we confirmed that over 1,000 frontline staff, primarily NHS, have been tested, also rolling out some testing to social care staff as well. And again, by Thursday, I expect we'll be able to provide an update on the numbers of our frontline staff that we have rolled out testing to, because of course we started slightly earlier than some other UK nations. We've been testing frontline staff since the 18th of March. Oh, and ITV.
Can I ask on field hospitals? You understand there are sites in West Wales, in South Wales. What about North Wales? Could you give us an update in terms of the thinking there and how much work has gone into a potential site in North Wales?
Okay, so a question about field hospitals, sometimes called Nightingale hospitals, depending on which news outlet you read. So we have confirmed the plans for West Wales, both Parker Scarlett Stadium, a range of leisure centres that are being converted, and here in the capital, the Principality Stadium. There's an agreement between the health board, between the stadium, and indeed work alongside local authorities to convert and provide up to 2,000 beds there. And in fact, we've got assistance from a variety of people, including the Army, who are there as we speak, going through how to we're able to do that. So we're able to learn some of the lessons from the work they're doing in the Excel Centre, and I'm confident we're able to move quickly to turn those facilities around. But every health board area, working together with their local partners, is look at the additional capacity that it recognises it will need. So in Gwent, I already made a decision about bringing forward new beds on the Grange University Hospital site for the step-up, step-down care. There's more that they'll be doing and confirming. And in North Wales, they are definitely having conversations about a variety of sites. So on Thursday this week, I expect to describe across the whole country the overall numbers, but what that looks like within each region of Wales as well. And I want to make sure we get that right, but this is moving at extraordinary speed. Normally, to make choices about having 5,000 plus beds in addition to our system, even if it is for step-up, step-down care as opposed to acute beds, you'd expect that would take weeks, if not months of planning, and then to get to the point of delivery. We're doing all of this in a matter of days. But on Thursday, we'll be able to describe those numbers and what that looks like in North, South, East and Mid Wales as well.
Can I ask on the reporting of deaths at the beginning of this outbreak? You were reporting the health board. The First Minister yesterday spoke about the decision not to do that because of identifying certain patients. But don't you think it would, A, can you explain a bit more about that? And B, don't you think it would be helpful for people to have a health board?
So it's a question about how we report deaths in Wales. So Public Health Wales are now reporting daily the additional numbers of deaths. And as the First Minister said yesterday, with relatively small numbers, it is possible to identify the families or the people involved. Part of the lesson learning from doing something that we haven't had to do before. So that's a deliberate choice to try to make sure that families themselves aren't identified. They're still relatively small numbers within each health board. If we disaggregate them rather than providing a national number, I think that would cause difficulties. But if we do see larger numbers of deaths, as unfortunately we expect to see larger numbers in the days and weeks ahead, then we may then well get to the point of changing that and providing health board breakdowns for the numbers of deaths in Wales. But every hour We have to make different choices, and every day we have to think about what we're doing. So we'll certainly be revisiting how we report, because we do want to be open with the public and at the same time respect the dignity of those people who won't want to be individually identified. We'll go to Dan, and then we'll come to Andy and Channel 4. Dan from Global.
Minister, first of all, start by asking about an Iron Bevan Health Board. We've been told that the high number of cases there is due to the proximity with England on the border. Early on, there was a case of an NHS worker who tested positive for COVID-19. Specifically with relation to the border issue, we've also seen in North Wales and particularly Mid Wales and Powys some of the lowest numbers of cases in Wales. So therefore, should those parts of Wales be concerned that they might end up with higher case numbers like the ones we've seen in Iron Bevan?
Was this a question about the numbers of infection rates in Iron Bevan, the Gwent area of Wales in particular? Now, the cluster in Gwent, as the First Minister set out yesterday, there are a number of possible reasons for it, but he was also clear, and we've also been clear, as indeed as the Chief Medical Officer, that we can't be 100% certain cluster of cases at this point in the spread of coronavirus. So we know there's a large amount of traffic flow between England and Wales that goes through Gwent. We know that there's a particular challenge in London, for example, that's circulating outwards through the rest of England. Now, the traffic flows through Gwent are different to Powys and to North East Wales. We can't be completely certain about all of the reasons, but we do know that in Gwent there was more testing because an NHS member of staff who early on was symptomatic and tested positive, so lots of persons contacted within the health service and wider were tested as well. What we do know is there's been relatively widespread community transmission, which is why we've taken the steps of an effective lockdown of large parts of public life and private activity as well. We're then focusing our testing resource on understanding where people are come in and are symptomatic into parts of our health and care system, and then equally, of course, on getting our frontline staff tested and back into the workplace. The current issue with Gwent is not one that I expect to see at the end of all of this. I do think that when we have denser populations of people together, the spread has been understandably more rapid than in our more remote communities. The measures we've taken to lock down large parts of the country are to interrupt that, to try to make sure the coronavirus doesn't spread in the same way. Now, that gives our NHS, as we know, time to prepare and to cope, and that should help us to save the lives of more people.
And you and your colleagues have said several times that this isn't the time to panic, but surely one of the best things that Welsh citizens that we could know is the number of people who are actually getting better. At the moment, that number hasn't been provided. Why is that, and when are we going to get a number of people who have tested positive yet recovered from COVID-19?
Well, we'll know lots more when we have the antibody testing, those people that have recovered. But we'll also be thinking about how we've had more information that people have been seen and treated and have left our hospital setting as well. But again, it's a moving picture within each day, and what I don't want to do is set out information we then have to correct within a day or two. So I want to get the information right, and then, as I said earlier, I want to be open with the public about what we're doing, both to scale up our response, but also what that then is in terms of people recovering as well. Andy from Channel 4.
I'd like to go back to the issue of the deal you say you had with the testing company, which fell through, because the issue of testing obviously is a matter of very significant public interest right now. 10 days ago, you issued a statement in which you said that on the 1st of April, tomorrow, Wales would be able to provide 6,000 tests a day. Mm-hmm. Can I ask you, was that projection based chiefly on the agreement you thought you had with that company?
So it's another question about the testing deal that hasn't gone through. And yes, the statement that I made on Saturday week was about our ability to get to about 1,000 tests a day, because the additional 5,000 tests a day that we're due to get. I have also said that this week we'll nevertheless be going ahead with over 1,100 tests a day capacity here in Wales.
But there is then a significant shortfall in terms of the number of tests you were hoping for this week. In fact, several thousand more tests would have been happening had that agreement gone through. And given the emphasis being placed, the public health emphasis think a lot of people would like to know whether you, as the Welsh Government, can shed any light whatsoever on why that agreement fell through.
So another question about the testing arrangement that hasn't gone forward in Wales, and I've tried to be clear and consistent about describing the fact that we had a written exchange, an agreement, as I said in answer to Felicity's earlier question, for that team to come to Wales and to make sure that that capacity was available. Now, I've also been clear about my disappointment that hasn't happened, and I recognise the public, and in particular our frontline workers, in increasing our testing capacity sooner rather than later. But I've also been clear that we're not going to get into naming the company, and our focus has got to be on providing more tests with the resources and the routes that we have got. So we've diversified the range of people we're working with, the offers of help we've had from a range of different private organisations, from the university sector, as well as NHS capacity as well. So you will see an increase, but there's no getting away from the fact that those additional tests that we were due to have would have made an earlier difference for us. Now, after this is all over, I'm sure there'll be lots of people to go over lots of the detail, but my time now has to be on getting things right for today and tomorrow, and the big challenge that we know is coming through the doors of our health and social care system here in Wales.
But you can't answer the question then, which is, can you shed any light on why it hasn't gone through?
I've been clear that the company themselves made a decision they weren't able to fulfil the agreement reached with us. And if I go further into that, then I'm getting into an argument about that deal falling forward and not spending my time on doing what I think I should do, to preparing our health and care system in the here and now for the challenge that is increasing every single day coming into our system. I know we've got a number of difficult weeks ahead of us. As I say, when all this is done, I'm sure there'll be lots more questions for all of us about choices we've made at various different points in time, including this particular aspect. Now, I know we've got questions that are coming electronically. We've got one from, we've got one about testing, which I've dealt with, and we've got one from Sam Coates from Sky about relying on a UK-wide system and whether there's enough trust to make sure there's a fair allocation to Wales in the months to come. I think there's a couple of different points to make. One is about resources. So you've already seen the Chancellor make announcements and a particular fund being provided to Wales across a range of areas. I've said, the Finance Minister has said, the First Minister has said, that from a resource point of view, it's really important that the UK government fund the need as it exists in different parts of the UK. Fortunate in Wales, in terms of the impact here, in which case our call on resources wouldn't be the same. But equally, if the other position were to be the case, and we had a much wider impact, a much deeper and harder impact in Wales than the rest of the UK, I would not want to see, and I do think it would be tenable, to have a UK-wide funding system and solution that didn't recognise the differential need that different parts of the UK will have. I can also confirm on some of the broader points about working within the four nations of the UK that the four Cabinet Health Ministers had a meeting at the end of last week to talk about our common expectations for the way in which we expect supply chains to work, for example, whether that's clinical consumables or whether that's PPE, to make sure that we have agreement on UK-wide rules and equity between the four nations of the UK, so that supply is generally being dealt with on a UK-wide basis. And the four Cabinet Ministers for Health were clear about our expectations. That's exactly what should happen. A question from Wrexham.com about inside Wales. What stops South Wales taking priority over the North for resources? Just as within the UK have been really clear, resources have to go to need, that has to be the case within Wales as well. And now is exactly the wrong time to go into stoking or creating divisions between regions of Wales that do not exist and do not reflect the way that the national government for Wales makes choices. I certainly make all of my choices as a minister for the whole country, and I hope people will see that as we make more and more choices to support our health and care system across the whole country, and indeed in response to Owen's question about field hospitals, when you see the plans that exist in every part of Wales, there is no prospect of one part of Wales being prioritised over another. the new antibody tests. We expect those to be available in a matter of weeks. As we get nearer to the time, I want to be clear with people about what that means, but in the national testing plan on the weekend, we've been really clear about the value we should expect to get from those, partly because Wales is a small connected country and our ability to link data anonymously means we should get even greater value out of that. Now, I expect that we'll share the learning and the knowledge that comes from that with counterparts within the UK and further afield, but that is a positive advantage of our SAIL anonymous data bank that we have to link up different records and what that means for the spread of coronavirus, but also the rate at which people are recovering. Are there any more questions on the screen, or is that it? On PPE provision, there is the rapid review of PPE provision that I referred to on the weekend. All 4 nations are undertaking a review, and within that review, we had lots of evidence being provided by a variety of different sort of individuals, but also all of the medical royal colleges have had a view as well. So the Chief Medical Officer and the Deputy Chief Medical Officer for Wales have been engaged and involved in that review. I expected that it would report yesterday. In the conversation I had this morning with the Chief Medical Officer, I now expect that to report later today. And that review will be important, both in terms of setting out those people who should have PPE and what form of PPE that should be, but equally those people who don't require PPE, and to make sure that we allocate the resources that we do have in accordance with that guidance. It's then important for the 4 governments of the UK to make sure we're reacquiring and resupplying our stock PPE in accordance with that guidance and any changes that might come from that. I've dealt with the question about staff. More of those questions, but more of the detail on Thursday. That's the same about the occupancy rates within hospitals. Are there any other questions? No. Okay, we'll go around the room. We'll go in reverse order. So, and then Felicity.
I think you said 1,100 tests currently in Wales. Is that correct?
Yeah, this week we'll get up to 1,100 tests.
And how do you see that being staggered over the weeks to come? Because if I think you said 2 to 3 weeks, 5,000 tests a day, can you give a rough idea? I know it's probably quite difficult to be precise at this stage, but a rough idea of how you see the numbers of tests rising over the next few weeks in Wales?
Question about our ability to increase testing over the next 2 to 3 weeks to get to the 5,000 figure that I indicated we should get to within that time frame. So within this week, we'll get 1,100 tests in Wales. We'll provide more detail as we get another step up, because different streams come on at different points in time. It's not a smooth linear progress to get to 5,000 tests, and it does rely on some of the other agreements with a range of different actors as I've described. But that should mean that we'll get a lot more of our frontline staff back to work and to resolve the worry that they have, not just for them and their families, but of course for the people that they're caring for as well. Dan.
Can I ask about yours and your colleagues' health? Of course, we've had the Prime Minister test positive, as well as your officer member, the health. What provisions are in place if any Welsh Cabinet Minister was to test positive, and are any of them self-isolating?
Well, we do have a number of ministers who are isolating because we've got ministers who are over the age of 70. So they follow the advice we've given to the broader public. And that's important that ministers set an example. None of the other ministers are self-isolating as far as I'm aware. None of them are symptomatic, but you'd expect them to follow that advice. Now, obviously, when I self-isolated and I then received a test, that's because I'm in a peculiar position. Myself and the First Minister are in a position where we will need to be more involved in a range of these choices than everyone else in the government. But we want to make sure that our testing capacity is used effectively, but that ministers themselves have to make sure they're able to do their job. So lots of the meetings that we're now having are remotely. So I've had a number of remote meetings today that would otherwise have been in person with lots of people in the room. So the way that the government works has definitely changed. And you'll see again tomorrow when the Assembly that the business of the Senate is being transacted in a very different manner. I don't think I'm going to be physically in the chamber. I'll be taking part remotely, relying on the magic of technology. But it's made a big difference, and actually there'll be lessons for us then about the future about how we undertake business when all of this has finally been resolved.
Can I just sort of follow up on that really quickly? Just on the priority testing, obviously, as you say, you received the test. Is that reserved only to yourself and the First Minister? Receive the test as a priority?
It's about whether they're key or critical to the national effort that we're taking through COVID-19. So just as that we're prioritising workers, for example, if the Chief Exec of NHS Wales were in the same position I was in, I would expect him to be tested to return to work. He is obviously in a peculiar leadership position within this crisis. Other people may not be so. Be sensible about in the way that we use our resources, but equally, can you imagine if the Chief Executive of a health board is out of the workplace and not able to function as effectively as they need to be, and we weren't in a said that person needed a test. So there's got to be some sense about how we undertake the way that we deploy our resources, because this is a challenge that we've never had to face before, and people with some of those leadership roles will have to be available as much as possible, even with different ways of working, to make sure we have the best possible response. This is a generational challenge for the country, and we need to act appropriately. Owain and then Felicity.
On a slightly different topic, can I ask, could you clarify the advice for separated parents in terms of custody and contact arrangements? Should that remain the same, or should there be different arrangements in place?
And my understanding is, and there was a bit of a wobble about this initially, but my understanding is that for separated parents, children should be able to transfer between the two of them if those couples, I know some couples, for example, have chosen to live together despite the fact that they're separated, but separated households, young children, so under the age of 18, should be able to transfer between those two households. And that's a pragmatic and I think a sensible choice. Otherwise, we put significant strain on those relationships. Actually, for those people who are isolating and following the rules, there's a strain on the way we undertake our normal activities in any event. So on separated couples, I hope that's clear about where we are. Christy.
Thank you. A wider question on Welsh Government policy, specifically the decision not to extend the business rate suspension to properties with a rateable value of over £500,000. Obviously, the First Minister has written to Tesco in particular to justify this policy change. Is now the right time to be engaging in controversies with supermarkets who are key in keeping us all going at this time? And what about the Welsh companies that are affected by this? Bluestone, Treco Bay, that sort of thing.
Okay, so two things. The first is we're not trying to engage in controversies with large commercial concerns. We're certainly not looking for supermarkets. As the First Minister has explained, a choice was made about those very large businesses and their ability to survive, and other smaller businesses who may have been much more. So that means that there's been a reallocation of resources for businesses that are less likely to survive in the future without help and support. We've also indicated that those businesses that are turning over their assets, if you like, to fight against COVID-19, will look again at how we provide support for them. So Bluestone and the Principality Stadium being two very obvious examples of they're directly involved in the way that they've made their assets available to the health and social care system for the fight against COVID-19, and we will recognise that in the way that we provide finance to support those businesses. Okay, well, thank you very much for your time, and I'm sure we'll have lots more to talk with you about remotely or in person at an appropriate distance in the future. Thank you.